Hello, my name is Victorio Anchalim, and today I go to talk about the prevention of the world-late shoulder and neck injuries.
Definition: Work-related injury to be an exposure or even that occurs in the workplace that either contributes to other cases or result condition or significantly aggravates a pre-existing condition. More specifically, work-related upper extremity disorders are defined as musculoskeletal disorder of the upper limbs and neck.
Alright, so today we're going to talk about a common problem that we see a lot, and that is upper trapezius and shoulder pain. So a lot of times when people are working at a desk job or they kind of tend to slouch their shoulders and carry some tension up here, that can cause pain and stiffness in the upper trapezius, upper shoulder area. So one exercise that we can do is called the shoulder dip or shrug. And this exercise strengthens the lower trapezius, which is down here, and the serratus posterior. These muscles tend to be underactive and weaker, but strengthening them will help relieve some of the tension on this upper trapezius, which is a huge muscle and tends to do more than it should, which is why it's tense. So now to the exercise. Find a surface like a table about this high is best. And what you're going to do is keep your arms straight, because this isn't a tricep dip. So keep your arms completely straight and shrug your shoulders up towards your ear and push up. So try doing about 3 sets of 10 of this exercise. You can do it daily or start out with 3 times a week if daily is too much. And really focus on squeezing those muscles that we talked about when you're doing it. And as those muscles get stronger, that should create more balance in your upper back and relieve some of the load from the upper trapezius as those muscles learn to do more of the work. I'm Savannah Mitchell from Loosen Up Bodywork.
Applications in physical therapy. These disorders can include tendon-related pathology, neovascular disorders, nerve atrophy, joint and joint capsule dysfunctions, and other specific and non-specific disorders. The world-layer upper extremity disorders can be characterized by symptoms including pain, feeling, swelling, numbness, loss of coordination or strength, or any physical change that may affect an individual's abilities to perform work or leisure activities. Pros and cons. Pros. The goals of physical therapy include reduce pain and stiffness, improve head and neck range of motion, develop dynamic straining of the neck and its supporting muscular, and develop strategies to prevent pain from recurring. Cons. Neck pain refers to pain anywhere from the area at the base of the skull into the shoulder. The neck includes the bones and joints of the cervical spine, the discs that separate the cervical vertebrae, and absorb shocks as you move, and the muscle and ligament in the neck that hold the cervical spine together. These problems are very helpful in all areas for people who have these injuries.
One of the more common complaints we see in a chiropractic office is a stiff neck. And a lot of times these problems are a result of improper posture. And with today's world, sitting in front of a computer all day, you tend to slouch a little bit and your head comes forward. And a lot of times that will result in a stiff neck or pain in the neck. And there are some things that we can do here in the office. One with the chiropractic adjustment, which actually addresses the joints and makes sure that your joints are moving correctly. There are some things that you can be doing at home that will help as well, some exercises, 6 in particular, that will help reduce the result of a stiff neck. The first one would be retraction of the neck, which is actually just simply bringing the head back to a more neutral position. And the next one will be using your hands, cup them together and place them on the back of your head. This time we're going to bring the chin to the chest and just a forward flexion of the neck. And with your hands, you're not pushing the neck, you're actually just gliding your head straight forward. The next one will be a lateral bend. And again, I'm going to use my hand and place it on my head and just bring my shoulder or my ear rather, to my shoulder in a light stretch, not pulling. And you're going to do this on both sides, using your hand just to glide your head, provide a gentle pull there. The next exercise would be for rotation, and this is simply just looking to your right and your left shoulder, bringing your head back to neutral each time. And the next exercise is going to be a shoulder blade retraction, which is actually just bringing your arms to about a 90-degree angle. And from here, you're going to contract your shoulder blades and bring them closer together. And you'll feel the muscles in between your shoulder blades contract as you do that. The last exercise I'm going to show you is simply a head drop, where you're going to let your head fall back and look up towards the ceiling, just like this. And then bringing your head back to neutral. All of these exercises can be done about 6 to 8 times each day, just as you're working. If you're sitting in front of your computer taking a break, doing these in the morning, just work them into your day as you would like, but these will help reduce some of the symptoms of a stiff neck in the future.
Issue applying in Ecuador. In Ecuador, much of this problem depends on work. Approximately 60% of workers in Ecuador have these injuries. Currently, some companies consider that this information to take action to reduce injuries to their employers. Conclusion: physiotherapy plays an important role in the prevention of work-related shoulder and neck injuries that affect these joints. Signs: this way the patient is aware of the problems they may have when performing a job with a bad position that affects their body.